Thank you everyone for joining and welcome to our presentation this afternoon, Telehealth Workflows. I'm your co-host, Dr. Barry Bittman. I'm the Chief Population Health and Quality Officer for the Inland Empire Foundation for Medical Care. I'd like to begin by thanking Dolores Green and the team at RCMA and IEFMC for enabling us to present today and for all of their dedicated work around the COVID-19 national health emergency. I'd also like to thank my co-presenter, Mitzi Young. She's the RCMA CMA physician advocate who has a wealth of information and provides a great deal of support for the physicians in our region. As we do this presentation today, we're going to ensure that we stay on mute so that you can hear me and that we will not have interference. We ask you to use the chat feature to write down your questions, which we will entertain at the end. There's also a great deal of information that you can review at rcmadocs.org, where we have a special section on COVID-19. There's a wealth of information presented in a concise manner that covers a number of topics that are going to be of interest to you and your staff. We've also prepared a synopsis of some of the telehealth applications that are available if you've not already purchased one. We have no affiliation with any of those organizations. Today we're going to present at multiple levels. The reason for this is that some of you are still using FaceTime and some of the non-telehealth intended technologies. So we're going to take you through some of the workflows in a very straightforward manner. And for others who are using fully integrated packages that come with your electronic health records, we're going to give you tips as well. Essentially, our focus today is really looking at how we can best serve the need of our community during this national health emergency. We're going to divide our workflows into three. The first is scheduling and prioritizing the sessions. The second is the actual visit. And the third is follow through and quality assessment. Three essential workflows that can help you either get started if you haven't done so already, or help you refine your overall strategies for telehealth. The idea behind our presentation is to give you a starting point. We realize that every practice is different and that your individual needs will require differences in the actual workflows or protocols that we're suggesting. Please remember that you can contact Mitzi. We have her contact information as well as mine at the end of the presentation if you have any specific questions that we can help you with. Bottom line is we've basically been existing in an environment of the COVID national health emergency for approximately 2 months. During this period, there's been a very strong push for telehealth for a number of reasons. Obviously, to try to ensure the health and safety of our patients, our staff, and our providers. It's also been facilitated by three factors that are rather important. The first is CMS and health plans' intention to provide on-par payments with face-to-face visits. Second, relaxed HIPAA regulations that enable us to use programs like FaceTime if you don't already have a telehealth application. And third, and this is perhaps the most interesting, is that many of the practitioners that I've spoken to around the country report newly discovered efficiencies from the use of telehealth, really focused on improving throughput and reducing no-shows in the practice. As we begin, we'd like to explain that the rules and regulations are changing and that we make every attempt to try to keep you updated through the documents that are available on rcmadocs.org. As the information comes into us, we report it as quickly as possible. You're probably saying to yourself, well, what happens if they completely rescind the rules for telehealth and we go back to where we were before? While no one has the actual answer for that, the bottom line is that there are multiple health-related organizations in the country that are strongly pushing for the continuance of telehealth. So if I were a betting person, which I'm not, I would like to offer my opinion that telehealth is here to stay, perhaps under some modified rules, but it's important for us now to be able to use this, especially during this period. With that, I'd like to introduce my co-host, Mitzi.
Thank you, Dr. Bittman. Good afternoon, everybody. Thank you so much for joining us today. Again, Dr. Bittman said we're going to kind of get you in the lane you need to drive down. I am the physician advocate for the Riverside County Medical Association and the California Medical Association. And really what that means for all of you and all of your staff is that I provide one-on-one assistance free of charge. So anything practice management that happens from 9 to 5, you can give me a call and I'd be more than glad to help you, including these workflows that we're going to talk about today. So really some preliminary suggestions that I wanted to make is really taking the time to refine that telehealth strategy that you already perhaps have in place or have begun to start that. You really want to make sure that you're looking at things like scheduling protocols. We want to get those down in writing, especially if we're going to change different employees with different, positions within the office. Your pre-visit and the day of and during visits are also going to be important to take a look at. Your post-visit as well. So really what you want to do is we want to encourage physicians to utilize a telehealth solution that makes sense the most for their practice in both the short term and the long term. I agree with Dr. Bittman. I think telehealth is here to stay, and that's exciting for a lot of reasons. One of the other things we wanted to talk about was kind of continuing to post warning signs. You want to keep doing that. We've got them available for you. I'm going to go over that in just a moment. Do not expose your patients unnecessarily to the waiting rooms, with symptomatic or asymptomatic carriers. So you really want to be cognizant of how you're setting up your waiting rooms, getting rid of all the paper, meaning magazines and your handouts and things like that. Those are things to think about. I'm going to run them through them pretty quickly, but we've got a really great opening your practice checklist and telehealth checklist. So don't worry, you can get everything that we're going to talk about today. Maintaining one line, a cell phone maybe an option for you for exclusive communication between the office and any providers and PAs or physicians that are working remotely. You want just a one-way conversation there that you can just maintain one line. I think that's really good advice. All providers should maintain remote access to the EMRs at home. That's including staff. So it's always a really great time to have a conversation with your EMR vendor or your practice management vendors to make sure that you can do this, and that if you need help right away, who to call, get everybody set up, get everybody in place. That'll make things really nice. Consider placing personnel on rotating teams and extend remote access. Again, this is also, you kind of right size your practice is what we're calling that. You may not need everybody to come in every day. You might have a staggered schedule for folks. Listen, telehealth has emerged as an effective approach for assisting with the management of chronic conditions, among other vulnerable patient groups who experience difficulty accessing routine care, health services such as homebound adults, for the frail elderly, and people with physical disabilities. So you want to make sure that you understand your patient and encourage that patient to do what's best for them, right? They want to be proactive in their healthcare, not reactive. And so we want to make sure that we're giving them exactly what they need and that we are understanding what they need. And that the capabilities, we're talking home computers, cell phones, landlines, those kinds of things. Do they have any of the social media platforms that you can, talk to them there? So those are the kind of things that you want to make sure that you're taking a look at. Next slide. Okay, so this is a really good area. I like this, and I really want you guys to spend some time within these 3 questions here. Consider how telehealth will be utilized in your practice. So let's just, put it out there. Before the public health crisis, virtual care was previously a nice to have, right? So it was just nice that you could have that. It is now an essential part of our new reality. And I think it's really going to work well in practices. I think we're going to see a lot more efficiencies, less no-shows. I think there's a lot of pluses to this. And so there will be a learning curve, and I encourage everybody to be patient with themselves and others in the office, because you guys will learn how to do this that will fit right in your practice and with the providers. So make sure that you're tailoring the approach that meets the unique needs of your practice. Super important. It may make sense to block off certain times during the week for remote visits. Some people can block out an afternoon or maybe a whole day. You probably don't want to mix those two, in-person and telehealth, together. It's best to have a little scheduling different there, blocking off time. So think about the goals for your telemedicine program. So things that impact it, like revenue and patient and experience and patient satisfaction, wait times, no-shows, cancellations, things like that. Providing virtual care doesn't start and stop with a telehealth video session. And we're going to get into that a little bit more as well as we get into this presentation. It also includes the ability of the clinical and non-clinical care team, patient and family members to virtually collaborate and coordinate care across the continuum of care. So I think that virtual care doesn't just stop with a telehealth video session. There's a lot more to think about. You also want to make sure that you understand the payer's telemedicine coding and billing guidelines, your contract, for instance. If you don't have your contract, I would suggest that you get your contract with the payers. And I've got a great request form if you need it. Again, we're kind of your one-stop shop. Please call us for anything. We've got the resources and can get them to you very quickly. So there are termination dates. We are working, California Medical Association, with the Department of Managed Healthcare on these termination dates that the payers have put out on their websites for COVID-related visits. So again, when you're getting those denied claims, if you do, and I'm sure there's going to be people that do, we want to make sure that you're giving us a call. So please call us and let us know, let us help and advocate on your behalf. Next slide. So we talked a little while ago about the signage. We've got these signs for you. We suggest that you put them in post them in English and in Spanish. Also, I would say that the CDC has some indoor and outdoor signs, along with some patient take-home care handouts. And you can certainly go to their website and then just /preparedness resources on the cdc.gov website. And they've got a plethora of information there. Certainly you want to visit the rcmadocs.org. Again, we've got a great COVID page, as Dr. Bittman had said earlier, and we want to make sure that you're visiting that and getting those resources. And if it just takes you too long, listen, guys, just pick up the phone and call me. Don't waste a bunch of time trying to figure out where to go on websites and googly things. So just make sure that you give us a call, because we're here and ready to help you one-on-one. Okay, back to you, Dr. Bittman.
Thank you so much, Mitzi. And I'd like to add something else at this point, which I think is really important. Face coverings are highly recommended by us in your office. Regardless of what the state regulations are, you really want to try to safeguard not only your patients, but your staff and your providers. So I highly recommend face coverings. In fact, if you go back to one of our prior presentations that we presented about 10 days ago, you'll find that we strongly recommended that you work on a throughput in your office which keeps only one person in the waiting room at a time. So let's talk about workflows. I think back about 6 or 7 years ago when I had the opportunity to develop a population health workflow for one of our large groups in Pittsburgh. And I'll never forget what a nurse said to me. She said, regardless of how good the technology is, Dr. Bittman, if you don't have an established workflow, it's not going to work. And I said, what do you mean by that? She said, if you don't have the rules in place that establish the consistency and a way to measure how you're actually performing, then there's no longevity to any of this technology. And I want you to know she was absolutely right. So let's focus on our first workflow, which is not surprisingly scheduling and prioritizing telehealth sessions. This is really about time management. It's about figuring out the right way to do this. It's about setting up an efficient scheduling strategy, not only for new patients, but for patients whose visits have already been scheduled for months and now have to be converted to telehealth. You're probably saying to yourself, you know, we're through most of this crisis at this point. Is this really important? I think time will be the judge of that. And I think we should be prepared for another surge, whether it occurs this summer or in the fall. So I have a feeling that working out the kinks in your strategies now, developing the right workflows is going to make a world of difference as we move forward. Before we even start to schedule, I think prioritization is key. And what I'm showing you now is the CMS tier classification, which is actually pretty straightforward. It couldn't be easier. Tier 1 is low acuity, Tier 2 is intermediate acuity, and Tier 3 is high acuity. For low acuity treatment or services where there really isn't much of an impact if you don't provide the service, it is strongly recommended that you consider telehealth, virtual check-ins, or remote monitoring. For Tier 2, which is really defined as having the potential for increasing the morbidity or mortality of the patient if you don't perform it, we still recommend that your initial evaluation be performed via telehealth with the idea to triage that patient during that visit and determine whether, one, they need to be seen in a face-to-face visit, or two, whether they should actually go to a hospital, be triaged for something more serious. Tier 3, from a telehealth standpoint, we really don't recommend. This is high acuity where there's a strong likelihood that not performing the service or treatment is going to be detrimental to the patient. And in this particular case, we would not recommend postponing any kind of personal evaluation or evaluation for that matter in a hospital triage setting. So what I'm going to do is really give you two workflows that are pretty much in parallel. Essentially, the first one is you've had patients scheduled for months and now you want to convert them to telehealth visits. The second are new office visits for patients who are not yet scheduled. Both of these begin with the development of a comprehensive patient call script. What are the things that should be said to the patient? What should be included? What are the directions, the recommendations? This would include, for example, wearing a mask in the office, not bringing more than one family member or advocate, and making sure that those patients are asymptomatic as well. There are a host of different factors that you can include in your script, and each one has to be personalized to how you actually run your practice. For those where you're converting the visits, we suggest that you look at your office schedule a week or so in advance, determine if telehealth is a reasonable option, and if so, look at Tier 1 and Tier 2 for each patient on the roster. Contact the patient and offer the conversion to the telehealth appointment, and then perform what we call a pre-telehealth visit review, which we're going to show you on the next page. This is really important. We also recommend that the day prior to the appointment, you basically confirm it. you secure and document a verbal consent, and you arrange for co-payments. The new office visit is very much along the same lines. Again, you're not converting the patient from a regular visit to a telehealth visit. And again, the protocol is more or less similar. This is assuming, for example, that you're doing this manually, that you're using FaceTime or a non-integrated platform. Now, we realize that over the course of the last several weeks, many of you have advanced to using fully integrated platforms that rely on a great deal of technology. In step D, for that pre-telehealth visit, in many cases that can be done with a portal-based pre-telehealth review. And for step E, that can also be done by text message confirmation and automatic co-payments, for example, via a PayPal. This depends on the system that you're using. I do want to emphasize one thing, and that is that this technology is phenomenal. It creates tremendous time savings and can be extraordinarily efficient, but it's not for everybody. There are going to be some elderly people in your practice that aren't going to want to work via text messaging or emails, and there's going to have to be some additional hand-holding when it comes to those individuals. Speaking of hand-holding, I'm going to turn you back over to Mitzi.
All right, thank you, Dr. Bittman. So what we're going to look at right now is the pre-telehealth visit review. So this is really important, and really we should have been doing this pre-COVID as well, and most offices were doing that. So I think it's really important and recommend when I'm in practices doing any kind of consulting for them or practice assessments, one of the things that I think is really important is that you check the insurance, the address, and the phone numbers each and every single time that a patient is coming into your office. Even if they're coming in 5 days in a row, still do it. And just get in the habit of doing that. Super important when you're doing telehealth. So remember that, you know, the current insurance information, when patients return to the office, their life circumstances may have changed. So any office staff that's kind of working in this arena should confirm patients' contact information, including addresses and phone numbers. Patient insurance eligibility should be ran 3 to 5 days before the appointment. And the reason that I tell you this is it's much easier for me to advocate on your behalf if you in fact get a denial because the patient was no longer eligible and you have proof that they were eligible at the time that you checked 3 to 5 days before the appointment. I like 3, but you can go as much as 5. It's easier for us to do this kind of work with the payer when we have that. Make sure that you are actually printing off not only eligibility, but the current benefits as well. Scan that and make it part of the medical record. Again, really, really good information to have in the event that there happens to be any problems on claims regarding eligibility. So if eligibility is effective, then you can collect your copays and, you know, look at the copays and the deductibles. Have they changed? Have any of the benefits changed? Those kinds of things. And you can talk to your patient about this when you're calling them for confirmation. Again, you want to know recent medical history, any findings, health challenges, present medication lists, and then any durable medical equipment needs, wheelchairs, walkers, things like that that they may need at the house when you're doing your telehealth. Next. So Dr. Bittman went over this, and I think this is just a fantastic graph, and I would really encourage everybody to make sure that they have a copy of this. I think everybody in the office should have it. It's a really great starting point. It's super easy. It's very simplistic. It's really easy for everybody to learn and kind of, you know, just take that and then expand to what you need in your practice. He kind of went over a little bit about the previously scheduled office visits. You want to make sure that you have a script. I think it's super important. I know probably pre-COVID you didn't have a real script, if you will, but I think it's important to do this now. Your communication levels have to be really, really high. So you need to be challenged if those things are not probably working really well in your practice, perhaps, then you guys can really be challenged and very rewarding after you get those communication, you know, up a little bit more within the office and with patients and family. So you really want to just use this. Again, I love it. I'm going to use it. I'm going to hand it out to folks. I think it's a really great place to start. Next slide. So we're going to go over actually the workflow to the actual telehealth visit. Next slide. So in the workflow number 2, for many providers, the provision of telehealth is a new experience. It is for all of us and at every level, right? So that's checkout and it's check-in and it's MAs and it's providers, and we're all kind of in uncharted territory, if you will. So during this transition and beyond, telehealth will enable you to continue caring for those patients who do not need to be physically evaluated, while ensuring schedule openings for those patients who must be seen. So you will have those folks that must be seen, and you'll have those folks that, your patients that actually want to be seen versus a telehealth visit. And we'll talk about that later. Also, COVID-19 reopening your medical practice checklist. It's fantastic. It's on our website at rcmadocs.org and on our COVID page. I would highly recommend you get that printed off and saved on your computer. Consider that some of your patients may be reluctant to present to your office in person during this challenging period. So if you're trying to really convert folks over to in-person and then over to telehealth, remember that you really want to kind of educate as you're trying to convert, because that will help you a great deal. Next page. So again, the telehealth visit informs the provider, the office staff should inform the provider about 30 to 40 minutes scheduling range for telehealth visits. So here's what I'm going to tell you. Now, you all know, I'm not going to tell you anything you don't know, that the number one, survey question that sometimes, a lot of times, most of the times, are unfavorable is wait times. So it's really important when you're doing telehealth that you don't keep somebody waiting on hold for 30 minutes or longer, perhaps, as they would in your waiting room in person. So be careful about that and be really cognizant of your time and your time management. So that'll be really important. Initiate the telephone visit 3 to 5 minutes in advance. You'll have probably somebody that's actually going to do that. Again, if you need to do these internal workflows, I'd be more than glad to help you develop them as well. And then you make sure that subsequently turn the visit over to the provider, right? And then for the provider, you need to perform the follow-up and the consultation, determine if a face-to-face visit should be scheduled just based on what you're seeing, if they sent pictures over perhaps, or you're getting any video and you're like, no, you really need to get in. So you'll determine that. Document and code the telehealth visit and it provides additional directions for the support staff. So I think that it's really important that you understand what the documentation is and you document, over document. That's what I feel like you should do. In those integrated telehealth systems over here, we've got kind of time-saving steps. And so really you need to look at your EHR scheduling and how you're doing that and how you're going to do it because they'll integrate into your telehealth. Software-initiated telehealth visit, so that sometimes is part of the integration. And then automated through your EHR. Perhaps the telehealth visit will be automated through there. You'll be able to run reports. There's different things that you can find in an integrated system. And so you want to make sure of what yours is and what you're able to do and maybe perhaps what you're not able to do in the system you currently have. And with that, I'll hand it back over to Dr. Bittman.
Thank you, Mitzi. That was a wealth of information. Just to summarize, we're talking about 2 parallel workflows. The first really sets a window or a range of time when that visit can happen so the person is available. The reason for that is that you don't want to quote the person a visit at 3:15, have the provider tied up and not get to the person until 3:45. So patients seem to be adjusting well to being given a realistic range with a call or a contact a few minutes before. The provider performs the workflow very much like any other follow-up or consultation. Of course, there's no physical examination. However, Many providers are asking their patients to do at-home blood pressure measurements or weights, for example, in the case of a person for routine check for congestive heart failure. The provider not only gets to interact with the patient, but also has an opportunity to determine whether or not a face-to-face visit is really needed at this point. And this should be the jumping off point for setting up that type of visit. Finally, the provider has to be cognizant of not only the correct coding, but directions to the staff. It can be simple as speaking with a member of your staff, or it can be as automated as documenting this information in your EMR and have a page essentially pop up for your staff member who knows exactly what to do, what to schedule, and how to work with the patient. Again, I want to emphasize that this might work well for certain patients. For other patients, especially the elderly or those not comfortable with technology, hand-holding is essential. So let's talk about the third and final workflow, which is focused on follow-through and quality assessment. You've heard this a zillion times in sports. The follow-through is essential for heightened performance. Here, the visit really doesn't end at the end of the follow-up or consultation. The manner in which you follow up is equally important. It also gives us an opportunity to sort of gauge the acceptance of our patients and find out what's working and what's not working. The coordinated series of steps that we're recommending is actually pretty straightforward. The idea here is to optimize patient outcomes and care experiences and provide insights for our practices so that you know what's working, what's not working, what needs to be improved, and you can gauge the success or impact of telehealth in your practice by doing this on a regular basis. Again, the essence of any workflow is consistency, and we suggest that you just don't check on these types of issues early on, but this becomes a consistent process that you use over the course of the next few months to really determine what's working and what's not working. With that, I'm going to turn this over to Mitzi.
Okay, great. Thanks, Dr. Bittman. So now we're going to really kind of talk about the staff taking on the patient's medical record and kind of getting things wrapped up. So follow through and quality assessment. So upon completion of the telehealth visit, office staff, upon reviewing provider's directions. So here's really what needs to happen. You need to call the patient and review the provider's directions, obviously, and confirm the patient's understanding. So I always like to say to folks, do you understand what we just spoke about? Or can you repeat to me the directions I just gave you? So those are two things that you may do with the patient at the end. Arrange for scheduling of ordered of tests and labs. Make sure that they understand exactly. They're not going to get the slip probably from you guys. It'll be sent off electronically to the lab and the patient will have to go. So we're going to need to make sure that we're communicating at a very high level so these things can get accomplished quickly. Perform the post-telehealth survey. We're going to talk about that on the next page. Schedule the follow-up appointment and review the survey results with the provider on a regular basis. So here's the thing. The best practice would be within no more than 24 hours. So same day to 24 hours, this call would be made to a patient. Okay, and so again, it's going to just take some really fine tuning in the practice. You're going to have some bumps in the road. Forgive yourself and the folks you work with because it's going to be a little bumpy at first, but it's going to be fine once you've got it down. So really, when I talked about the patient surveys, these are really, really important for you guys to do. You should be doing them pre-COVID. A lot of folks were doing that. Please remember that the payers are actually doing surveys on your patients. So every time they get a claim, a survey goes out to the patient. So if they're doing that, I think you should be surveying your patients as well. And you'll need to do this when telehealth becomes a bigger part of your practice. So one of the things that Dr. Bittman early talked about was kind of the things that really work well. So efficiencies and no-shows and things like this that will really help in telehealth. probably the only thing that I have read or seen in any surveys or studies that have been done on telehealth is patients just say the loss of the personal connection. That would be only really the negative that they would say, is that they've lost that personal connection with the office, right? So communication at every level is crucial so that the patient still feels the personal touch they would receive in person. More than most likely, you're actually going to be talking to the patient a little bit more if you put those workflows together. And as with any patient experience or satisfaction surveys, those review sites like Yelp and Health Grades and Vitals, you should look at the surveys on a constant basis. I would recommend weekly. Somebody needs to be able to look at those websites and see what's going on. The best way to do it is to Google the office name or the doctor's name, and then those websites will pop up, and then you can go and look at those reviews, how old they were, those kinds of things. It's nice if you can guide patients to websites for a positive experience survey, and that they might have something great to say about the practice or the doctor or any of the staff members. That would be great. Making sure that you're looking at these are going to be really important and help to give you some insight in what you can or should be changed in workflows and internal systems and policies. So use them as a training guide, right? Sometimes we can get a little bit like, that didn't happen, or I know what patient that was and that's who said this, and you want to respond. Please don't do that. Just use it to your advantage, which is really going to be the resource for change in the practice, right? Because these are the people that you serve. So regular staff meetings should be done often, perhaps once a week as you're getting started, and move to 2 times a month or once a month, whatever works for you all. I will always recommend a daily huddle for 5 to 7 minutes to start the day off, get everybody on the same page, know what's happening, who's out sick, who's covering, what we're doing, what provider's here, and include the provider in that as well. Very, very good idea. Next, please. So your post-telehealth survey really is...
Mitzi, before we go to the next slide, I'd just like to make a comment here. I agree with everything that you said, and I think your directions are phenomenal. However, I want to show you the flip side of the equation here. I'm a different type of patient. I really don't want that call after my telehealth visit. If you just send me a quick email or text message verifying what I should be doing, telling me that my prescription is being called into the pharmacy and that I should schedule a urinalysis or a specific test, I would prefer to have that by some electronic means. So I really would not need those extra steps. And the advantage of using some of the high-tech telehealth solutions is all of that is built in and is automated. Again, that's the type of person I am. Not every one of your patients is going to feel comfortable with it, but I wanted to present the other side of the coin. So here's the next slide.
Thank you. Thank you so much, Dr. Bittman, for that insight. So your post-telehealth survey, you know, again, I think that these are really good. Dr. Bittman and I would agree. 5 to 7 questions. You really want to keep it down, folks, because people just don't want to fill out these long pages, 20, 30, 40 questions on surveys. So I love these 5 questions. I think they're exactly what you need to know and that you want to know, and it will help to promote any change that you need to make in the practice. So that's a really good survey to do. Or you can also go on to, I saw one on SurveyMonkey that I thought was really good. They had a nice one called Telehealth Client Satisfaction Survey. You may check that one out, or you may have one of your own. So I just really would say that you definitely want to make sure these surveys are done. This will also help to determine what patients prefer, right? Telehealth and which prefer in-person visits, because that makes a difference. Many practice management scheduling systems have the ability to make an alert note that pops up when anyone is logged into the patient's demographic or the patient's account. So I would make sure that you have that information. This person is an in-person only or prefers telehealth. That's just an easy one for everybody to understand when they get into that patient's account. It'll pop right up the minute that they pull them up. So with that, I'll send it back to you, Dr. Bittman.
Thank you again, Mitzi. And looking at the flip side of the coin again, I advocate the personal touch. I think that's really important. But for someone like me, if you provided a Likert-like survey that I could just click a few buttons on and get back to you, I'd prefer that over speaking to someone. So again, that depends on whether or not that's built into your technology. But even if it is, please be certain that you focus on the patient who is not comfortable with technology. This is a summary of workflow 3, and this is really the follow-through that we're talking about. The most important thing is to verify the patient's understanding, sort of like teach-back moments that we have at discharges in inpatient settings. We have to make sure that we schedule the ordered tests and labs. For some of these tests and labs, we simply give the person a slip, or we can send them an email or text message that they can take to the lab. The survey, whether it's done electronically or via phone, is key. And always remember to schedule a follow-up appointment. So this just sort of summarizes that workflow 3, and it gives us an opportunity to look at what we should be doing and what we should be reviewing on a regular basis. My final recommendations are pretty straightforward. I believe that this is a real opportunity. The cloud perhaps has a silver lining. Perhaps medicine will never be the way it was previously. Perhaps we can work together and make it better. I'm not an advocate of doing everything via telehealth. I'm a physician that would like to impress upon you that hands-on is certainly important, that connecting with that patient face-to-face is critical in many situations. However, especially now when we're not out of this COVID national health emergency, we really have to be focused on doing the right thing to preserve the health and well-being of our patients, our staff, and our providers. I'd also like to mention that if you're doing annual wellness visits via telehealth, there is a point at which you have to complete them by doing the physical examination, and you should plan to do that whenever possible, perhaps within 120 days of a period where you can really get people back into your office. It's important to follow up on these to establish a scheduled visit or a tickler file that will make sure that you complete these services effectively for your patient. Finally, as I mentioned previously, as both of us have stated, I don't think there's any real turning back. I think there will be regulatory changes. There's certainly going to be speed bumps, and not everybody is going to agree on how to proceed. You're probably also going to look at these 3 workflows and adjust them for your practice, for your style of delivering care. Our goal was to provide templates for you that would basically cover the areas that you should be thinking about before, during, and after the telehealth visit. What you ultimately do has to work within your practice setting with your providers and staff. And finally, I'd like to call out to Manifest MedX. They are working diligently during this period. They're working with integration with a number of different vendors, and they're also providing reports that show you which patients in your practice might test positive that you may not be aware of, and you can get also alerts on when these patients are hospitalized. Finally, I'd like to again thank the Riverside County Medical Association and Inland Empire Foundation for Medical Care. There is a wealth of information on RCMA docs, and these are either references for where you can get more information or how you can contact us directly if you have questions, and we would expect that you would. Our reopening checklist, which we covered the week before last, is really something that every one of your practices should look at, both providers and staff, to help you to basically take into account all of the strategies that you need to employ to safely begin seeing patients again in the office. And finally, we get a tremendous number of calls about PPEs. So here's the PPE Direct Online website where you can order for your practice. With that, again, I'd like to thank everybody for participating today. And I'm going to ask Dolores Green if she could present the questions to Mitzi and I for our answers.
Great. Okay, so let me call them up real quick. So the first question is, how long is the plan to continue telehealth for IEP patients?
I think I can take that one. The best answer should come from IEHP. I know this is an unusual call out, but is there anyone from IEHP on the call right now who would like to answer that question?
Dr. Bittman, everybody is muted, so let me see how we might.
So perhaps the person from IEHP could add a response in the chat, and we can unmute them.
Perfect, then we can unmute them. So let's go ahead and go on, and then we'll come back to that question. So, okay. What timeline are we looking at to start over 2-year-old physicals?
I don't have the answer for that. My recommendation is you stay in touch with the American Academy of Pediatrics, and I'm sure they are providing the most up-to-date information as it evolves and changes for recommendations with young children. Next.
Okay, and if I might add, you might want to look at our reopening checklist and the webinar that we did a week ago. And that provides a guidance on opening back up your practice, the steps that you need to take, etc. If you couple that with the American Academy of Pediatrics, I think you'll find guidance there. Okay, the next question is, our doctor wants to see more patients in the office. Should this be done now? Really doesn't want to do telehealth, wants to phase it out.
My recommendation is going to be based upon the fact that I believe the situation is more dangerous now than it was 4 to 6 weeks ago. I think we're seeing escalating numbers. We've had recent changes in the state regulatory environment. I can tell you around the country, there's been a lot less social distancing. And when people ask me where they think we stand now, my answer is going to come after the first week of June, when we're going to start to see those results. So my recommendation would be that we continue with telehealth, at least for the next few weeks, until we see what impact the state regulatory changes have on our numbers. What's concerning me is that the problem hasn't disappeared. The numbers are greater than they were before. The impact hasn't been fully established. The use of antibodies is in great debate right now, and my assumption is that we should assume that everybody that we're in contact with outside of our homes has COVID. Next question, please.
Okay. Will CMS extend the telehealth visits being paid at the in-office visit past the May 30th date?
I'll turn that over to Mitzi.
Yes, so we do know that right now we're working, CMA, the California Medical Association, is working with CMS. Remember that telehealth, again, is going to be here to stay. So although I don't have direct information because it's still ongoing, as we said, these things are changing on a daily basis. Make sure that you're looking on the Noridian website and the cms.gov website for any information, along with rcmadocs.org. And as soon as we get information, we get it out to you immediately.
And
Thank you, Mitzi.
This, Dolores, and I'll jump in, and I'm sure Dr. Bittman, you have thoughts on this too. But even though we know the regulations are going to change, like Mitzi said, May 31 is just days away, 4 days away. And I do not believe that we're going to make any movement right now in making changes to the payment structure for and we will get
I agree.
as soon as we can.
Absolutely.
So, Dr. Bittman, we've stayed in close contact with IHP, and so I think you're fairly confident in answering the question that was asked about IHP. I did not see an IHP representative that let us know that they're on. So, do you want to go ahead and answer the question, which is how long is the plan to continue telehealth for IHP patients?
I believe that IEHP has been extraordinarily diligent and focused on the task at hand for the last several months regarding the COVID challenge that we're facing. I believe that they will extend this as long as they see necessary. And again, I think the real indicators for us, we're going to see perhaps by the middle of June, when we can see what the impact of all of the regulatory changes are in terms of social distancing and masks. So I can't speak for IEHP directly, but I can tell you that their focus has been primarily on the well-being of their patients and the provider network. Next, please.
That concludes the questions that have been entered into chat.
Thank you, Dolores. Are there any other questions? One more chance to get in there into this chat line and post a question for us. Okay.
Dr. What I may, just to let everybody know, we are going to have another webinar next Tuesday at this time, and it'll be focused on the information that is available to physicians on their patients that are in the health information exchange, and we'll highlight the COVID information that is contained within the HIE and how you can access that. So you should be receiving by afternoon another invitation to participate in the webinar next week.
Thank you, Dolores. And I'd like to take this final opportunity to thank everybody for hanging in there and participating in this call today. Thank my co-host Mitzi, Dolores Green, and the team at RCMA and IEFMC. And please accept my appreciation for your extraordinary work on the front lines. Please stay well. Thank you.